are the three birth to three coordinators, so they have a tentative agenda, and they just, I think Tony, Leanne, and Ruth Ann are just going to talk about, you know, what we did, how we came to that together. That's great.
For some of you that might not know, our dollars came through to specific county birth to three, but then the state also said if you are willing to work across county lines, cross boundaries, and start a consortium, then there was another chance to get some more ARA funding. And
that they don't understand it. They might have developmental concerns about their child, but may not be willing to have that identified at this time, or that, you know, maybe life is just so stressful that they just need a little bit of assistance.
Lines of communication open and keep the good ideas flowing too, because again, there are some things that we can do at a state level as a convener or as a modifier of some of the policies and ground rules. Not that we have a completely free hand, and also in terms of the relationship with the federal government, which again, not all the resources in the world there either. But having said that, there really is some new attention and new energy behind this work, given obviously the investment in the of all the things to put money into in the Recovery and Reinvestment Act. Here went all this money into birth to three, and it was one of those cases where we thought, as you know, we thought we were going to get $6 million, and then it turned out we got $7 million. How often does that happen? Oh my gosh, really, every day in county government. So there's an opportunity here, and there's an indication of a federal commitment to try to raise all boats, and you're doing everything you can with every person, not to mention every dollar that you can try to repurpose. And I think the ask that I would have, just as you have here, is that you keep sort of every now and then sit a few rows back and look at a systems level and say, all right, we could do so much more if. And if there are some of those things that we at the state level can help you with, we really want to know that. Here in Timberlake, I'm the Secretary of the Wisconsin Department of Health Services, and we're here today because Governor Jim Doyle every year for the last 8 years has held a northern tour where he takes his whole cabinet up to the northern, really third of the state, to make sure that we as cabinet secretaries and a lot of our senior staff can connect with the people and programs of northern Wisconsin. So today we were talking in particular about the Birth to Three program, which serves kids between 0 and 3 years old who have developmental delays, speech delays, physical delays, and it's a shared program that's run by both the federal government as well as the state government and county government. In the Recovery and Reinvestment Act of 2009, the stimulus bill, there was a significant amount of money invested in helping counties expand, states and counties expand the services that they offer to kids and their families through birth to three. And here in Washburn County, there's a very innovative partnership going on between Washburn, Burnett, and Sawyer counties actually, to make sure that they can make best use of that money and get a lot of new staff trained and new resources available so that they can provide the best possible service to families in this area. So because this is a program that my department has responsibility for, it's important for me as a secretary to hear firsthand from people about what they're doing and what opportunities they see, and also some challenges that they see that we at the state can help them with.
So what did you learn today as far as anything unique to the north area, north part of Wisconsin?
One of the things I learned is that there's obviously a real commitment among these three counties in particular, and I'm sure shared beyond these three counties as well, to help one another meet the needs that they identified. So we heard quite a lot about, as people were having difficulty with finding a certain kind of resource, they would send a staff person from one county back to school to get trained up to meet that need. And now among these three counties, there's a commitment that as they develop new knowledge and new skills and new expertise, they will share it with their other county partners. So instead of having all three counties have to spend that money to go get that expertise, one county can do it and they can share it with each other. We also, I think, learned quite a lot about the fact that while we're, as a state, doing a pretty good job of reaching parents and kids to make sure that they know about the Birth to Three program, there's more we could do. I think particularly working with our partners in the healthcare delivery system, working with pediatricians and other private healthcare providers to make sure that they're looking for kids with developmental delays, and that when they find them, they're referring them to Birth to Three programs as a part of the array of services that a family might need.